All right, so this morning, this is the equity considerations, and we've got Heather Rigney, Jackie Kelley, Kristin, I don't know how to say your last name. Brynga, okay. And we have Holly. Miranda is not in the room, she's virtual today. So I'll turn over the floor to you.
All right, well, thank you all for attending. We are very excited to be able to do this collaborative presentation between Vermont Department of Health and Vermont Emergency Management. As you know, equity is becoming more and more a consideration in the work that we do and the plans that we write. We have a focus on whole community, and as we go into more disasters and more frequent disasters here in Vermont, we are realizing the gaps in our plans. So through this presentation, we are going to be discussing some of those gaps and those lessons learned and how you can apply issues of equity to the work that you do in the future. So by the end of this presentation, you as participants will understand why equity considerations are critical to whole community planning. You'll be given some concrete examples of how equity can be incorporated into the planning process using lessons learned from two different incidents that we're going to highlight. One of those being the 2023 floods and one being the 2024 measles case. Participants will also be introduced to some tools and tricks that are available for you to use in your planning process.
So we just wanted to cover what disability access and functional needs means first. So basically it's an umbrella term that covers anybody who needs extra assistance to prepare for, recover from, or respond to an emergency. So this is not an exhaustive list of the people that fall under disability access and functional needs. So you might be able to think of some others, but predominantly it does include people with permanent or temporary disabilities, which includes people who experience mental health, pregnant people, people who do not understand, speak, or write the primary language, infants and children, people with limited access to transportation, unhoused populations, tourists and visitors, and people with limited access to financial resources. And this is a chart that was presented through the Agency of Health and Human Services. So on the far, your left, the Executive Order 13985 explains what underserved communities are. And we have these here for you because these terms are often interchanged. People use them to describe the same thing, but they are actually a little bit different. So underserved communities includes Black, Latino, and Indigenous and Native American populations, members of religious minorities, LGBTQ+, persons with disabilities, people who live in rural areas, and then people who are otherwise affected by poverty and inequity. At-risk populations is defined as people with limited English proficiency or non-English speaking, older adults, children, pregnant women, people with disabilities, and so on. Access and functional needs, you may notice that some of the things that I said are not in this definition. So a lot of states have been taking this kind of basic definition and including more into it. So like pregnant people, people of low socioeconomic status, people experiencing homelessness fall into access and functional needs. So just kind of wanted to clarify that. And then protected classes is also important to understand as well, because these are groups of people who are legally protected. So if you're creating a document, you might have to refer to these classes or say a protected class for legal reasons. Okay, so the framework is basically that there's resources that everyone needs during emergencies, regardless of who we are. And so everyone needs access to resources to function during emergencies. And it's also important to go back one more. Okay. It's also important to know that public health and emergency management think of this a bit differently. So public health thinks about this in terms of equity considerations, and emergency management thinks about this in terms of resources. Okay. So the gold standard for accessibility practice is having multiple means of engagement, multiple means of presentation, and multiple means of action and expression. And this just basically, we use the term multimodal. So if you're needing to do some sort of communication, maybe you want to have it written, you want to have it in plain language, maybe you're going to put it out in some sort of video or something of the sort, different languages, stuff like that. That's multimodal, different ways that people can access the same information. Okay, and so CMIST, I'm not sure if everyone is familiar with this, but this was developed in 2006 out of the U.S. Health and Human Services Working Conference on Emergency Management in Individuals with Disabilities and the Elderly. So it's basically a memory tool which includes the 5 functional resources that people need during emergencies and disasters. So those resources are communication, maintaining health and medical, independence, support services and safety, and transportation. And so how this fits into whole community inclusion, by integrating, coordinating the access and functional needs of the whole community in preparedness, response, recovery, and mitigation, we can just better account for those people and not leave them behind. And by utilizing the CMIST resource framework, the inclusion, diversity, equity, and accessibility of the whole community can be addressed. So this here is a graphic of what's called the CMIST elephant. This was created out of Colorado. This kind of just helps people understand what CMIST is, in the sense that it's kind of a puzzle. You might have to do bits and pieces at first. So yeah, and then I just kind of wanted to touch on like some examples. So for communication, an easy example is like ASL. Maybe someone needs ASL. Maintaining health and medical could be durable medical equipment. Independence would be, for example, let's say there's an emergency. Instead of sending people with certain needs to like an institutional setting, you're giving them the opportunity to go to an emergency shelter that's accessible to them and has the resources there. Safety and support could be personal care assistance, and T is transportation, so maybe accessible, wheelchair accessible transportation.
All right, so now that you've got the basics down, we want to kind of delve into some case study type examples. The first one I'm going to do is from the July 2023 flooding. Of course, not to be confused with the July 2024 flooding, because that seems to be our life now. So as we've been going through our after action reports, we've been kind of looking at it from the lens of equity considerations and access and functional needs. And a lot of what has come up from that is communication barriers. So lack of translated emergency notifications was one. They were pretty much in English only for 2023. We did have the Vermont Language Justice Project that created translated videos in multiple languages, but there was a timing delay in that, so it wasn't available to us immediately, and they also left out ASL at that time. Another thing was limited emergency information specific to access and functional needs. The Health Equity Advisory Team at the HAWC, which is the Health Operations Center, that was not activated immediately. So there was some communication barriers and information was not necessarily pushed out in a timely fashion or at all in some cases. So there was health disparities that really weren't addressed timely. The other thing was the multi-agency resource centers and the disaster recovery centers. There were some barriers there. Lack of signage was a big one. Trying to direct people into there just wasn't there. Water test kits were another big thing. The process for requesting them and receiving them was challenging to navigate, and the hours for pickup and drop off were limited. And then to turn in those kits, there was like a complex form that they had to fill out. So there was issues with linguistic and literacy barriers, just trying to facilitate that. And again, limited translation materials at those facilities too, to provide to folks. And even though the Vermont Language Justice Project, who's handling a lot of those translation services, was able to kind of get on board late in the game, but we just didn't have it up front. And there are just not enough of them to go around to be able to help everybody at the same time when everybody from across the state is trying to access those things. So lessons learned. So obviously we're just coming off the 2024 flooding. And we're still in the process of kind of looking at that and seeing how everything played out. But currently we do have the alerts written in English, and we're using Google Translate, which is not ideal, to translate those. But obviously those of us sending them aren't fluent in any of those languages. We have no secondary review currently. So right now, we obviously are in the process of trying to get a more robust methodology to develop more accurate messaging to come out. I know the Language Justice Project had about 9 videos in, I think, 19 different languages for the current round of flooding. So we are a little bit more on top of the game than we were last time. Obviously, still some limitations there, but we did have ASL included, and the timing delay wasn't quite as bad. The DRC, there was some rebranding that went on through AHS, with signage and just trying to make those a little bit more accessible to people. The verdict's still out exactly how well that worked. We're still kind of evaluating and seeing how that all played out for 2024 since that's so recent. The health equity team for the Hawk was activated early on in the flooding this time. So that timing delay wasn't there, allowed to get some information out a little bit more quickly. And the water test kit accessibility, there was actually, I believe, a work group that was set up after the 2023 flooding. So they were able to do a better job of getting the information out, pre-staging some of those assets so that, they were at locations where people actually were, they could get them a little bit more timely, return them a little bit more easily. Next slide. And another change that came out, and this is new, kind of in process currently, was there's actually a legislative mandate right now for Act 43 that created the Language Assistance Services for Emergency Communications Work Group. And what that group does is it's tasked with developing the best practices for the provision of language assistance services and emergency communications, identifying the geographical areas within the state with the greatest needs to language assistance services, analyzing and making recommendations for those technologies. And then they actually do have to submit a report, I believe it's due December 15th, to the legislator with those recommendations. They've been meeting, obviously the flood and everything kind of has shaken up their scheduling a little bit, but they've been meeting a couple times a month to try to get that taken care of. We have representatives from VEM on that, our director, Eric Foran, I believe Mark Bosma, our PIO, and our section chief, Brett LaRose for Ops and Logs is also on that. There is, let me see, Office of Racial Equity, Vermont Association of Broadcasters, the Vermont Deaf, Hard of Hearing, and Deaf Blind Advisory Council, and I believe there's a few others that I'm kind of missing here, but it's kind of a collaborative group that's trying to address some of these barriers throughout their work.
So in April of 2024, the Vermont Department of Health responded to a complex measles exposure. And this occurred when a group of international travelers came to Vermont, and we were informed that the entire group, composed of adults and minors, were exposed to a confirmed measles case. And for this response, it lasted approximately 41 days. Now, some challenges that were noted while we worked through the after action report were similar to the flooding in that document translation was something that we had to work on. Consent documents in particular need to be translated and signed by the guardians located overseas before VDH could continue working with the minors in any capacity. Cultural considerations. There were some cultural aspects that could have been better handled when working with the individuals themselves and not working through the partner organization. And then additionally, communication with the travel group. VDH's communication with the group was regulated by one person for the entirety of the response, which strained VDH's rapport with group members. And then upon the closure of the HMC, so some lessons learned that we came across were vaccination guidance. The travel group organization is working with VDH to develop vaccination recommendations for future international programs that visit Vermont. Document translation. Compared to the July 2023 flooding, the process of translation documents is constantly getting better streamlined. And then community partner engagement. While the travel group was interacting with local community partners, it would have been beneficial to VDH to also engage with those community partners earlier to best serve the group and within their cultural context. And this can also include engagement when there is not an emergency event happening.
All right, so from these two cases, I think you guys have a sense of the fact that pre-planning in all instances would have been beneficial to the organizations that were involved to be able to not only write these types of considerations into plans, but to test the communications and the other aspects in advance. I want to touch briefly on some tools that are available for all of our planners in the room to use. That will just give you a sense of who is in your community and who you need to approach in order to get a sense of where they're at in their own personal preparedness planning, agencies that work with those individuals and the individuals themselves. The first tool that I think all of us are most familiar with is the US Census. It's put out every 10 years and covers a variety of demographic and social aspects of the communities, all the way down to zip code level. On an annual basis, there is a subset of the US Census called the American Community Survey, which is not as robust as the census itself, but it does ask a lot of the types of questions that you as emergency planners can use. I was on their website researching this presentation, and I actually found out that there is a disaster and emergency preparedness subsection of the US Census that's called My Community Explore. And it's actually an interactive GIS map that not only maps out the disasters that are local to an area, but overlays information gained from the American Community Survey onto it so that you can see, specifically populations affected and whether they are in a floodplain, for example. So that's a really interesting tool. It's been around for decades, very robust, has a lot of support from the federal government. The Social Vulnerability Index is a tool that we here in Vermont use. It is based on census data. And again, it's interactive GIS. The way that it works is we take 16 of those priority questions that the census asks that are specific toward the health of Vermonters. And we overlay that information into a GIS map for our communities. And what we do is we actually provide a ranking of it so that those communities that score poorly, I think it's the lowest 10% in the 16 questions, get what we call a red flag. And you can see how many flags your community has to know how vulnerable your population is. And these are all things for public health type considerations. So it might be access to health care, it might be chronic conditions, it could be any number of things. HSS Empower is a tool that Medicare puts out, and that is a catalog of individuals who have power needs in emergencies. So folks that might have home oxygen, folks that might be on home ventilators, people that use BiPAP machines, and so on and so forth. And they pull all Medicare recipients and classify them down to census tract and zip code level to be able to show disaggregated data about how many folks in your community have a power dependence in case we have a long-term power outage, for example. Put that check in your checkbox for binary blizzard this year. The other thing is local registries. We have the E911 care system here in Vermont, which is a voluntary registry where folks can self-identify as having a disability or having an access need, request themselves on the registry, and that information is available to emergency management directors and fire chiefs as a planning tool. And some of that data can get disaggregated or can get individualized in times of emergency if there's a need to do a well check or to go out to somebody's home in a particular neighborhood. Certain of your local communities also run their own registries just for their town, just for their citizens. So all of those types of things would fall into this local registry category. There are other tools out there. If you have a particularly good one, we would love to hear that and include it in our resource list to share with this group. So these are some examples on how to use the data. So just, US Census data tells you that English, Portuguese, and Spanish are the main languages in your community. You can use that to take the templates for your emergency communications or some fact sheets that might be available to a recovering community and have those pre-translated in advance. The Social Vulnerability Index says that 8% of your population does not own a car or have reliable transportation. If you are in a community where you do not have public transportation per se, this enables you to reach out to other groups that might have access to vans or wheelchair accessible vans, your local churches, your community groups, your school, that might be able to sign an MOU with you in time of emergency to make sure that you can get to those folks who are isolated. Empower says you have 14 members of your community who are Medicaid recipients who use power-dependent home oxygen concentrators. If you have to move that body of folks or a subset of those folks during an emergency, do you need to make sure that your hospital has a supply of oxygen if they're going to the hospital? Do you need to make sure that your general assistance shelter is easily accessible by EMS in case somebody has an oxygen need, or that you have a medical subset of your shelter that can deal with folks like this so that they're not burdening your healthcare system unnecessarily? So these are all planning tools that you can use, and it just requires you to look at the data and to think outside the box.
Okay, so we wanted to touch on registries. Heather did just mention that about the CARES registry, which is a statewide registry, and then the more localized registries. So there's some problems with registries, which we want to touch on. In the state of Vermont, we do use registries, but it's important to understand the impact that they can have both on the community and on first responders. So first of all, they can create a false sense of security, meaning that people who are signing up for registries, whether it's a local one or the CARE one, might automatically think, okay, I'm done, that's it. They're going to come to my house. I don't need to do any other emergency preparedness. That is not the case. The CARE registry has added some information about that to notify people that this does not mean that personnel are going to be able to get to your home. Do other preparedness, especially if roads are cut off, they may not be able to get there, or there's a lot of just different things going on. They may not be able to respond to individuals' houses. It could be a long period of time before they do that. So it's important just to understand that. Also, these registries are geared towards disability access to functional needs populations. Not everyone will necessarily identify with that or identify as being disabled, but still might benefit from being on the registry. So when you're talking to people, it's just important to, tell them that you don't have to identify as being disabled to be part of this registry. A lot of people don't know about the registry, and there's kind of this false belief that everyone knows about it. That is definitely not the case. And then people may not really understand their needs enough to be able to fill out the registry, because filling out the registry does require you to think about, okay, what if an emergency happens? What do I need? And that can be it's a really scary thing for people to think about. And so they might just be like, nah, I don't even want to think about it. Or they simply just might not know what their needs are. And also there's a false sense of belief that people with who might be signing up to these registries are always home or always at work, because those are the two addresses that these registries usually require. But the reality is that when an emergency happens, they could be anywhere. They might be home, they might be at work, but they could be at the grocery store. They could be anywhere. And that can kind of create kind of misuse of resources when you're traveling out to people's homes and they're not even there. It's just hard to kind of know where people are going to be.
All right, so local emergency management plans that the municipalities have. I'm sure many of you are familiar with these. In those plans, there is a vulnerable population section. I have it in quotes because we're kind of going away from that terminology, but right now that's what it is, so I've left it in because that's what you're familiar with. So what those sections typically have right now is really oftentimes a list of the organizations or facilities that serve those populations. So it could be daycares, could be schools, assisted living facilities, with a name and a contact number. So when something happens, they have a way to contact those organizations. hopefully, as we kind of continue on this process, it'll be a little bit more robust in terms of kind of like pre-planning, making sure you're in contact with those organizations ahead of time, understanding kind of how they can help you in an emergency, how you can help them, and what those needs are, and making sure that that's all up to date. One of the things that I've been tasked with at VEM, which is still in process, is kind of developing an equity gap analysis tool to kind of help with that. And really what that is for the LEMPs and for other plans, the intent is to allow you to kind of look at some parameters and make some assessments as to where your planning might be a little bit deficient, so you can kind of hone in, because obviously we don't have, you know, infinite resources, right? So we've got to prioritize different areas. So that's in process. It uses the CMIST framework that Jackie had talked about, and it'll also have qualitative and quantitative tools. Gonna go to the next slide. So this is in draft only. It's not final. This is what I've been working on. So what it is essentially it's going to have different parameters on the side. Like this one says, for instance, reflects a commitment to provide all emergency messaging in an accessible ASL format. So you can look at your plan. You can say like what we're doing currently, is that a best practice? Is it satisfactory? Might need a little work. Is it developing? Have we not even considered it? Or is it not applicable? And it'll give you a score. And then there's going to be a score for each of those CMIST components. So you can kind of look and see, okay, well, you know what, we're doing really good on communication, but we're not doing so good on transportation. So maybe we need to look at that, you know, as a priority item for this year. So that's in process. So hopefully that'll be finalized in the coming months and be accessible for people to use, but I'm still working on it.
All right, so we want to leave you with some thoughts. A huge chunk of this presentation is really focused on the communication needs of individuals, because people don't know how to act or how to respond if we can't reach them in the early stages of the process. So we just want to throw out some examples of communication from the pre-alert. So this might be your Vermont alert type of emergency messaging that something is occurring or something is imminent, translated into the languages of your community. The middle picture is a snapshot from the health department's webpage with translated recovery materials. You can see the subsets. We have an entire list of documents that are available in up to 15 different languages in many cases. The picture here on the right is an ASL translation of a communication message. So again, you have the speaker on video verbally addressing the audience. You have the ASL translator doing the translation as well. We know not everybody learns by the same style. Some folks might want to go to the written material. Some people need to see it, need to hear it to be able to process it. So the more multimodal we are in our translations and in our language services of all kinds, the more audience members we're going to meet. Again, you know, not everybody's going to have access to TV and radio and the traditional types of media that we tend to lean on. If this is a large scale, you know, blizzard, power's wiped out, something along those lines, we may not have access to technology. So you need to really think outside the box and ways to communicate with folks. I think a lot of the ones on the left here are the traditional ones that most of us as emergency managers and emergency preparedness folks tend to rely on. Your VP alert, your websites, TV, radio, your social media. That one's becoming more and more critical as folks move away from mainstream. So your WhatsApp, your Instagram, your Facebook, you know, using those as a primary communication tool is becoming huge. Community listservs, if you have one for your town, or you know, the police department website, or wherever that place is that people go for information. Your traditional newspapers, again, great for recovery information, not great when the tornado is barreling through your neighborhood. You want to also think outside the box and communicate with agencies that are familiar with and comfortable working with your disability access and functional needs populations. Because they have their own internal communication methods, whether it's emails, whether it's call downs to get to those folks. Bulletin boards. In Vermont, we don't have big bulletin boards, but sometimes we use bulletin boards at our local grocery store, right? Flyers, yard signs, our public works, our electronic sign packages, a lot of them are solar powered. So communication in a power deficiency is still possible to direct folks to a place you need them to go for services. And then there's always the, you know, knock door to door. drive through the neighborhood with a PA system, making announcements. It's the most basic, and it's really hard when you have difficult to access locations, but you can have a huge number of people in a short time just by having concentrated resources that can go out and do that. So who's your whole community? Only you can answer this. Every one of us has a different community, from the very, very rural all the way up to the urban. But we all have agencies that service folks in our community. So whether it's home health, whether it's designated agencies for mental health, whether it's advocacy groups, community action organizations, whether it's local clubs, whether it's your transportation rideshare folks or your bus service, with organizations that aid in communications. Do you have a Races Club? Do you have an Aries Club? Does the library offer seminars in multiple languages or to specific subsets of your population? Do you have some of these niches like sports camps or summer day camps or Bible camps or whoever that you need to reach out to in an emergency that may not be a year-round thing? So only you know your community best. But when we talk about the whole community, we talk about reaching, not just the majority, but the last and the least and the ones that are hard to get. And now is the time to do that when you don't have a flood lapping at your door. So we just want to leave you with some resources. This presentation, my understanding, is going to be shared with everybody who attends the conference. I encourage you to go on to both BEM and VDH's web pages and look at the tools that we have available to you. There's also some federal resources, and this is not exhaustive, that you can use to look at specifically equity-related information that might benefit you. These are the resources that we used in the creation of the case scenarios and our contact information. If you want to reach out individually to any of us, we would encourage that. So thank you.
So this is the point where we're going to stop the presentation that will be put online, but we will open the floor to any questions anybody has in the room, and those joining us virtually can put them in the chat and I will share them with the presenters. So if anybody has any questions.